Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What does a high or low MCH blood test results mean? Mean corpuscular hemoglobin, MCH, is a blood test used to measure the average amount of hemoglobin in your red blood cells. Hemoglobin is the protein in red blood cells that carries oxygen to tissues as blood circulates in the body. /r/n/r/n. The MCH test is included in a panel of tests called acomplete blood count, CBC, which not only looks at red blood cells but also white blood cells and platelets. /r/n/r/n. By comparing MCH results with other tests in a CBC, your healthcare provider may be able to diagnose certain conditions or help narrow the causes. /r/n/r/n. Low MCH values may be a sign of anemia or an inherited blood disease called thalassemia. High MCH values may indicate vitamin deficiency, alcohol abuse, an underactive thyroid, or other causes. /r/n/r/n. Andrew Brookes, Getty Images /r/n/r/n. MCH values are described in picograms of hemoglobin per cell, pg/cell. The MCH is calculated by dividing the total amount of hemoglobin in your blood, in picograms, by your total number of red blood cells. This yields the average amount of hemoglobin per red blood cell. /r/n/r/n. An MCH test result is normal when it falls between designated high and low values, known as the reference range. Anything above or below the reference range is considered abnormal. /r/n/r/n. MCH reference ranges vary by age and sometimes by lab. They are generally considered normal at the following values. /r/n/r/n. Hemoglobin is a protein that transports the oxygen your organs and tissues need to function. It also picks up carbon dioxide so it can be removed from the body. /r/n/r/n. When combined with oxygen, hemoglobin gives blood its red color. As such, if your MCH is low, your blood will be less red. If your MCH is high, your blood will be more red. /r/n/r/n. In adults, an MCH level below 27 pg/cell is considered low. Anemia is the most common cause of this, defined as having too few red blood cells or too little hemoglobin. /r/n/r/n. A low MCH is typically caused by a type called microcytic anemia in which red blood cells are abnormally small. /r/n/r/n. A low MCH may also be due to conditions that cause hemolysis, the destruction of red blood cells. While hemolysis is a natural process used to replace old cells with new ones, it can cause anemia if an excessive amount is destroyed. /r/n/r/n. Possible causes of low MCH include /r/n/r/n. People with low MCH levels tend to have overt symptoms of anemia, including /r/n/r/n. An MCH level above 31 pg/cell is considered abnormally high. This means that there is more hemoglobin in red blood cells. /r/n/r/n. There are several common reasons for this. /r/n/r/n. People with high MCH levels may experience many of the same symptoms of anemia as people with low MCH levels. But, in the presence of conditions like megaloblastic anemia and polycythemia vera, they might also experience /r/n/r/n. An MCH is commonly performed as part of a CBC. It may be ordered for a routine checkup or if you have signs of anemia, whether macrocytic or microcytic. /r/n/r/n. On its own, an MCH cannot diagnose any medical condition. It may open the door to possibilities, but it is only when compared to other blood tests that it has any interpretative value. These include a subset of tests in the CBC called the red blood cell, RBC, indices. /r/n/r/n. Along with the MCH, tests in the RBC indices include /r/n/r/n high and low values of each of these tests correspond to different conditions, some of which overlap. By comparing these values, the lab and health provider can better narrow the possible causes. Other tests can then be ordered to confirm or rule out the suspicions. /r/n/r/n The MCH blood test is part of a complete blood count test. The MCH shows the average amount of hemoglobin in your red blood cells. In adults, an MCH of 27 to 31 pg/cell is considered normal. /r/n/r/n Low MCH values may indicate microcytic anemia, including iron deficiency anemia, or conditions like liver disease, kidney disease, blood loss, or thalassemia. High MCH values may indicate macrocytic anemia as well as conditions like polycythemia vera or a deficiency of vitamin B12 and folic acid. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.